Hi everyone, this is a road nurse with my first video. As you can see, I'm extremely new at this, but I figured I'd give it a shot. I'm using free software because if this doesn't take off, I don't want to spend a bunch of money. If it does take off, I'll upgrade the software and do more than just take notes on my tablet. Anyways, the point of this is to talk about certain things that we're learning in nursing school. There's a lot of new information that is coming at us in nursing school, and it's hard to keep some of it straight. So I'm calling the series Down and Dirty, where I take certain topics, break them down, try to make them easy to understand, and maybe that'll help me keep track of everything too. This is not the be all end all for all information, but it's a start. So the first thing I want to talk about related to hemodynamics is mean arterial pressure. So many people are familiar with blood pressure. You hear constantly, you want a blood pressure around 120 over 80, give or take. Maybe a little bit less is fine too. And that does give you a lot of information about what's going on in your body. However, that's one, or if you consider systolic and diastolic different data points, that's two data points. A third one to look at is your mean arterial pressure. That gives you information about the perfusion of your different vital organs. So how do we calculate mean arterial pressure? So there's this handy formula where you take 2 times your diastolic blood pressure, add your systolic blood pressure, and divide this number by 3. Now, this isn't anything you're probably ever going to have to do by hand. It's just helpful to keep in the back of your mind. Most computer systems nowadays, they'll calculate this for you. So, looking at our patient with 120 over 80, let's figure out his mean arterial pressure. So you take 2, multiply by diastolic blood pressure, which is 80, and then you add systolic blood pressure, which is 120, and you divide this number by 3. Since the computer will calculate this for you, I went ahead and calculated that it is about 93. So what does that mean? That's a good number to have. Your organs are being perfused because according to most literature, a mean arterial pressure greater than or equal to 60 is the goal. One thing to keep in mind that I'll get into in a minute is that our patients do not read the textbooks, so don't get focused on the number 60. That is one data point, so you need to look at your whole patient. So say, for example, you have a patient whose mean arterial pressure is 62. On textbook, that sounds fine. That sounds great, fantastic. Everything's being perfused, right? Not necessarily, because like I said, patients don't read textbooks. So you need to look at your patient and look at the status of their vital organs. So what exactly are you looking at? You're looking at brain, heart, and kidney. Now, what happens when your brain isn't being perfused properly? You'll see a lot of altered mental status, maybe some confusion, some new aggression, lethargy, if it's bad enough, maybe a loss of consciousness. And granted, this can be caused by many different things. If you have somebody whose blood pressure is tanking, their mean arterial pressure is kind of on the edge where, am I concerned, am I not concerned, and they're altered, those data points are kind of starting to add up, especially if you're looking at the heart and you see signs of ischemia. What are signs of ischemia? Think MI, heart attack, chest pain, diaphoresis, shortness of breath. And again, many things can cause these symptoms, and you certainly need to rule things out before going in one direction. But this is another data point where, combined with your questionable mean arterial pressure, your altered mental status, something's going on. Now, your kidneys are actually a great way to measure your perfusion status because what happens if your kidneys aren't being perfused? They produce little to no urine. So you will see decreased urine output. And what you want to see is 30 milliliters per hour. And that gives you a good idea that your kidneys are perfusing, which means your heart, your brain are also perfusing. Now, obviously, you might have patients with chronic kidney disease, so this measure may not make sense if their baseline is producing little to no urine. So always remember the numbers tell you a lot, but your assessment is extremely important in painting the entire picture. So that is it for this video. Thank you to anyone and everyone who has watched. Consider subscribing. You don't have to, no big deal. I just hope that somebody enjoyed this and hopefully it helps somebody. I will have more videos coming out soon. I'll be continuing the hemodynamics topics, so please keep in touch.